With the presidential election 1 week away, it's worth reviewing how Obamacare will impact the residents of key swing states. In Wisconsin, as elsewhere, Obamacare will drive up the cost of private health coverage, especially for those who buy insurance on their own. One of Obama's key health care advisors, Jonathan Gruber, found that by 2016, individual premiums in Wisconsin will increase by an average of 30%. In addition, Obamacare will deeply cut Medicare Advantage for more than 300,000 Wisconsin seniors enrolled in the program. And 27% of Wisconsin physicians say that they will place new or additional limits. Thank you for trying verbose. This recording will go away once the product has been purchased. On accepting Medicare patients. Read on for more details. Disclosure: I am an outside advisor to the Romney campaign on healthcare issues. The opinions contained herein are mine alone, and do not necessarily correspond to those of the campaign. Individual markup premiums to increase by as much as 85% in July of 2011, the Wisconsin Department of Health Services asked Jonathan Gruber and Gorman Actuarial to estimate the impact of Obamacare on the private insurance market. The Gruber-Gorman report makes clear, as do similar reports for other states, that Obamacare. Thank you for trying verbose. This recording will go away once the product has been purchased. Web of insurance mandates and regulations will dramatically increase the cost of individually purchased insurance. By 2016, according to Gruber and Gorman, overall premiums will increase 30% on average in the individual insurance market. As the table above shows, only 5.5% of Wisconsin residents will enjoy lower premiums, whereas the remaining 94.5% will face increases. 41% of Wisconsinites will face premium increases of 50% or more. Because Obamacare forces insurers to cover a buffet of benefits that they don't have to today, the cost of insurance will go up. Another driver. Thank you for trying verbose. This recording will go away once the product has been purchased. Of higher premiums is the fact that insurers will have to cover everyone, regardless of previous health status, a change that will attract sicker enrollees at the expense of healthier ones. Some Obamacare defenders try to argue that these cost increases don't matter, because a slice of the low-income population will benefit from the law's subsidies. But if you're not eligible for subsidies, or only partially eligible, you will be exposed to the law's dramatic increases in the cost of insurance. And remember that Obamacare has an individual mandate, which will force most Americans to absorb these. Thank you for trying verbose. This recording will go away once the product has been purchased. Higher costs. Obamacare to cut Medicare by $9,459 per Wisconsin retiree. Obamacare cuts Medicare by $716 billion between 2013 and 2022 in order to pay for part of the law's $1.9 trillion in new healthcare spending for younger people over the same time frame. My co-blogger Robert Book and Michael Rampett have published a paper for the University of Minnesota showing that Wisconsin's share of those Medicare cuts is $11.7 billion. This year, Wisconsin has 948,489 Medicare enrollees, which means that these cuts amount to $9,459 for every senior in the state. Thank you for trying verbose. This recording will go away once the product has been purchased. Robert Book published another paper, this time with former White House budget official James Caprita, detailing Obamacare's cuts to Medicare Advantage on a state-by-state basis. Robert and Jim found that, in 2017, Obamacare will cut $3,496 in Medicare Advantage services for every Wisconsinite enrolled in the program, a 28% cut. And 32% of Wisconsin's senior 301,548 are enrolled in Medicare Advantage. Survey: 22% of Wisconsin doctors will stop accepting Medicare patients. Last month, the Physicians Foundation published one of the largest physician surveys ever conducted in the United States, with 13,575 respondents. Thank you for trying verbose. This recording will go away once the product has been purchased. They asked physicians a broad range of questions, including several about their views on Obamacare. 55% of Wisconsin physicians said that the Affordable Care Act made them less positive about the direction and future of health care in America. Only 17% said it made them feel more positive. If Medicare fees decrease by 10% or more, as the Affordable Care Act will require, 27% of Wisconsin doctors say that they will place new or additional limits on accepting Medicare patients. 22% say they'll stop accepting Medicare patients altogether. In August, I wrote about one such thank you for trying verbose. This recording will go away once the product has been purchased. Physician Paul Baersch in Madison, whose clinic was the first in that city to stop accepting Medicare. According to this survey, many more will follow. The survey also has bad news for cheeseheads on other forms of insurance. 23% of Wisconsin physicians say that they'll place new or additional limits on Medicaid patients as a result of the Medicare cuts. 21% also say they plan to raise fees on those with private insurance in order to compensate for the cuts. More state-by-state analysis forthcoming. This is the second and thank you for trying verbose. This recording will go away once the product has been purchased. The series of posts I will publish on the effect of Obamacare on individual states, so long as Hurricane Sandy doesn't knock out my electricity. The first piece, on Ohio, is here. I'll link to the other posts when they're up. In the meantime, stay safe.